So, I got a question actually the other day on my Instagram about IV medications for anesthesia. And is it that Michael Jackson drug?
Yeah, you get that a lot. Like
Do you get that a lot? Do you get that a lot?
Yeah,
when you
all
meet
the time.
patients?
It's like, oh, are you going to give me that MJ juice?
Yeah.
And
the MJ juice. That's
the
it.
MJ juice, and they're like, oh my gosh, you use that, and so that is specifically speaking to propofol. Propofol is an old drug, and it is a very useful drug.
Powerful drug.
Very powerful drug.
Very powerful drug.
It is, and it's got a lot of great things about it, but like pretty much 99.9% of the medications out there, it has side effects. But like every drug, the side effects can be to your advantage and they can be minimized, but it's all about the appropriate use by the appropriate person and the appropriate provider. Propofol is an anesthetic. We use it what it does is it causes you to lose consciousness and
amnestic effect.
It will cause you to have amnesia where you don't remember, and it will cause you to have loss of consciousness, total loss of consciousness. It will cause you to stop breathing at higher doses. Okay. So as the dose goes up, as lower doses, it just kind of makes you go to sleep, which is what Michael Jackson was trying to obtain, because Michael Jackson had severe insomnia. So what he was using propofol was to sleep. Well, as I was stating earlier, sedation is a spectrum. So if you start to convert into deeper sedation, at propofol at higher doses, or it starts to build up into your system, if you're not clearing it fast enough, the doses get higher in your system, it will convert you into deeper sedation and take away your drive to breathe, and you won't breathe, which is what happened to Michael Jackson. He was overdosed on propofol.
By an unlicensed provider.
And it was being provided by an unqualified provider in an inappropriate setting on top of that.
Right.
I want to be with full disclosure. I don't know all of the details. I don't know if he was on monitors or not or anything like that. I don't know what that doctor's qualifications were. I'm almost positive he was not an anesthesiologist or a nurse anesthetist or anything like that. So I don't want to speak to the specifics of that case, but I do know a lot about propofol. And I know that handled in the appropriate setting by the appropriate provider, it is a very useful drug that you want to be using.
It's one of the most common.
It is one of the most common
we use in the United States, correct?
Right. It is a very common.
Is that just
drug.
a United States thing, or is it a world?
No,
thing?
no. It is a worldwide used drug. It is a very safe drug used properly. It is a very useful drug. It has a lot of good things about it. It puts you to sleep very quickly. It helps you relax. It actually has an anti-emetic effect, helps with nausea, and has a lot. We use it a lot at ACPS, and I've used it rampantly at many institutions all over Houston.
Right.
And we are trained on it, and all of the facilities all over the United States train on it. And there is no reason to be afraid of it if it is being used by the appropriate provider in the appropriate setting. It's absolutely no reason. And there's very few drugs that you can substitute for propofol. If someone has a true allergy that you can't use propofol, there are a few other options. There are I shouldn't say there are other options, but they aren't quite the same. They're not quite the same.